Does IVF cause ovarian cancer? I'm Dr. Jessica Reineck. I'm a double board certified OBGYN and reproductive endocrinology and infertility specialist, and I am going to talk about that question today. So let's talk about infertility, IVF, and other fertility treatments, and its link to ovarian cancer. The bottom line, in case you don't want to watch this whole video, is that at this time there is no evidence that assisted reproductive technologies and fertility medications lead to an increased risk of ovarian cancer compared with the elevated baseline risk of ovarian cancer that people with infertility already have. So what I mean by that is that people with infertility have a higher risk of ovarian cancer just at baseline, and that is due to not having had children, more ovulations throughout their lifetime, higher likelihood of endometriosis. And this is a study that takes a look at that, and it compared primary infertility with secondary infertility, endometriosis, and other factors that were associated with ovarian cancer. And it was found that especially those with endometriosis or those with primary infertility who never end up having a child as having the highest risk of ovarian cancer in this population. And this is important because that means that studies to look and see if fertility medications or treatment itself increases the risk of ovarian cancer, it needs to be comparing infertile people who have fertility treatment to infertile people who do not have fertility treatment, not comparing infertility or people who have fertility treatment with people who don't have infertility at all, because that will always show that there's a higher risk of ovarian cancer. So this is one such reassuring study that looked at over 30,000 people who had assisted reproductive technology versus about 10,000 people who had a diagnosis of infertility but didn't go through ART, and compared the ovarian cancer risk, and there was no increased risk between those two groups. This was another study that pooled over 8 case control studies, and that resulted in over 5,000 cases, as in those exposed to fertility medications, compared with over 7,500 controls, as in those with infertility that didn't get these medications, and they also did not find an increased risk of ovarian cancer. And this is a Cochrane review, which is typically considered to be a very high level of evidence, and it pooled together 11 case control studies and 14 cohort studies totaling over 180,000 women, and they found that there was no increased risk of invasive ovarian cancer in subfertile women treated with any drug compared with untreated subfertile women. Now, the one caveat is that there are some observational studies that do suggest an association between fertility treatment medications and what's called a borderline ovarian tumor. The studies are pretty small, and so there's not great evidence at this point, but there may be a slightly increased risk of a borderline ovarian tumor. Although there also may not be, as there's not shown to be a dose-dependent response. So it's not like the more cycles you use of these medications, the higher likelihood you have this borderline ovarian tumor. These are incredibly rare, so it makes it a lot harder to study. But what's really important to know is that it is not likely to progress to invasive disease. There's excellent survival, especially if stage 1, and typically treatment is surgical and curative. Overall, the data regarding ovarian cancer and fertility treatment is pretty reassuring, especially when compared to the appropriate population, and you can rest easy that IVF and fertility treatment drugs, there is no evidence at this time that it can cause ovarian cancer.